On this Wednesday night, the cost of living and its effect on your bottom line. Canada's inflation rate soars to a level not seen in almost 20 years.
My grocery bill has doubled, maybe even tripled.
The impact on food and fuel prices and interest rates. Healthcare workers ordered to get the jab or lose their job.
We stand by the policy.
Multiplying fears of what the vaccine mandate could trigger. Recommendations for royal rest, why the 95-year-old monarch has canceled a trip. Promise in pigs, a surgical first that could one day help people waiting for organ transplants. And status update.
They see that they need to evolve themselves.
Facebook's plan to rebrand and focus on the metaverse.
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin with what many Canadians already recognize. The cost of living is climbing in this country. The price of everything from groceries to gasoline to housing is going up, and the inflation rate is now the highest it's been in nearly 2 decades. It hit 4.4% in September. That's the biggest yearly increase since 2003. In the last year, the price of food jumped 3.9%, housing costs rose 4.8%, and gas prices spiked nearly 33%. A number of factors are driving up costs, and one of the key questions is whether interest rates will go up too. And Gaviola has tonight's top story.
It's a sound that can make your heart race. And that anxiety is justified. Nearly everything costs more right now, and few places make that as clear as the checkout aisle.
I have 6 kids, 5 are boys, so they eat a lot. And my grocery bill has doubled, maybe even tripled. And that means we have less disposable income to go out.
Canadian households are feeling the financial pinch. An Angus Reid poll released today shows nearly half of respondents say they're struggling to cover their grocery bill. In fact, 87% say the rising cost of living is their biggest concern, overshadowing fears of losing income or being jobless.
I think everybody just has to learn how to budget, and we have to live with it. There's nothing that we can do.
But buckle up. There's more to come.
You had temporary factory closures, you had higher input costs, as well as the general theme of supply chain disruptions. So all 3 factors contributed to push up food prices.
This inflation is likely here to stay, even though at the start of the year, economists painted it as temporary. It's been running hotter than the Bank of Canada's target rate since the spring. And with global energy prices on a tear, you can expect higher prices at the pumps and beyond until spring of next year, putting the Bank of Canada in a bit of a bind.
The Bank of Canada is going to talk like a hawk, but walk like a dove.
Analysts say this could spur the central bank to raise rates sooner rather than later in 2022, perhaps in the second half of next year.
Because the Bank of Canada is likely to move before the United States Central Bank, that means a stronger Canadian dollar.
For households and many businesses sitting on record savings built up during the pandemic, this gives them a cushion and time to prepare.
It slowly creeps up on them that, all of a sudden, wow, I'm paying more money for my debt, or I'm paying more money for my goods. And as a result, then, they have an epiphany or some sort of revelation that, wow, I might have some financial problem here.
But those struggling financially, especially businesses, could be pushed over the brink. And this comes just as key federal supports are set to expire on Saturday. Donna.
And Gaviola in Toronto, thanks. MPs get back to business in Ottawa in 1 month, and vaccinations for COVID-19 will be mandatory for everyone, including visitors and journalists. Only those who have a valid medical reason are exempt. Prime Minister Justin Trudeau is in talks with the other federal party leaders about the protocols for the next session, and our David Akin is keeping an eye on all this. David.
Yeah, there's still a lot of issues to be worked out, but one rule is clear. MPs must be vaccinated to sit in the House or even to enter the buildings that their Parliament Hill offices are in.
I think there's a lot of relief that this decision has been made for the parliamentary precinct, knowing that all visitors, all MPs, all staff on premise are going to be vaccinated is a huge sense of relief, and I think entirely appropriate given the public health circumstances.
Now, the Conservatives hate this rule. They object to mandatory vaccines for MPs, just as they objected to mandatory vaccines for civil servants. Now, the only exception to this rule, as you mentioned, those with a valid medical reason, and those few will have to be tested daily before entering the Commons. Still not clear how this will be enforced. The parties are still working that out. And this rule does not apply to senators, who will figure out their own rules. Also, this rule that everyone entering any of the House of Commons buildings must be vaccinated, well, it applies to all political staff, every civil servant, all contractors, and yes, every journalist. Donna?
Okay, David, so apart from vaccines, will it be business as usual? Are MPs required to be physically present in the House?
That, too, is still up for discussion. Now, Liberals and New Democrats believe that the hybrid model, where MPs are participating by video conference, is still a valuable one.
Having spent millions of dollars to develop these tools, it makes sense to continue to use those tools in an appropriate way.
But once again, the Conservatives have a different view. They are insisting it's time to ditch the hybrid approach and move completely to in-person proceedings. And they have the support of the Bloc Québécois on that. But the majority rules here, and the Liberals plus the NDP, they have enough votes to prevail. Donna?
Okay. David Akin in Ottawa, thanks. Mandatory vaccine policies are being put in place in many places across Canada and running into some opponents. In Alberta, more than 100,000 healthcare workers have less than 2 weeks to get their shots. The vast majority already have, but others are holding out and face being put on unpaid leave. Heather Yourex-West reports.
Since the beginning of the pandemic, Shelby Bay has been eager to lend a hand. The Cochrane, Alberta nurse works with the Red Cross and has been deployed all over Canada. She's now working at a COVID testing center close to home.
If me being at the testing center can relieve one less overtime call, then that's a win.
Bay is one of 13 Red Cross healthcare workers on active duty in Alberta. Outside resources coming in to help, just as some workers within the province are choosing to resign. On October 31st, all Alberta Health Services employees will be required to have 2 doses of the COVID-19 vaccine, and not everyone is willing to comply. AHS says that out of more than 108,000 workers, 92% have now submitted proof of vaccination. But there are 1,200 employees seeking an exemption to the vaccine mandate, either for medical or religious reasons. 61 workers have resigned because of the policy, including 31 clinical staff.
We stand by the policy, and it will be fully implemented. This vaccine requirement is essential to ensure the safety of our people, the patients, and vulnerable Albertans.
Last week, with concern mounting its mandatory policy could lead to healthcare shortages, Quebec pushed back its deadline. In Manitoba, there are 158 health workers on unpaid leave for refusing the vaccine. And across the country, legal challenges to similar policies are before courts and human rights commissions.
I think by and large, the mandates will stand, and that any successes we'll see will be one-off situations in particular cases where, as I say, an individual maybe doesn't get a health exemption that they should have received.
Of course, the major test will come as these deadlines pass. And in Alberta and BC, those deadlines are next week. Heather Yourex-West, Global News, Calgary.
Plans to vaccinate American children aged 5 to 11 against COVID-19 have been laid out by the Biden administration. There will be no mass inoculation sites. Pediatricians will be enlisted to work with parents, and the vials and the needles to administer doses will be smaller than those used for adults. It's anticipated U.S. regulators will approve the Pfizer-BioNTech vaccine for use in children in the coming weeks.
Pending the CDC's decision, we'll ship about 15 million doses out nationwide in those next few days, with millions more going out each and every week to make sure that we're matching the doses with where they're most needed.
FDA advisors are set to meet with Pfizer next week. The drug maker says clinical trials show 2 doses of its vaccine produce a robust antibody response in children aged 5 to 11 who are given a smaller dose than those over age 12. Today, the agency also authorized the mixing of vaccine doses for booster shots. For hundreds of thousands of Canadians, it has now been more than 8 months since they got their 2 doses of the COVID-19 vaccine. Their immunity to the virus is now waning, and experts say it's time to focus on giving booster shots to those aged 65 and older. Jamie Maracher explains why.
Benita Silver is approaching her golden years. She's also asthmatic, so she knows every breath of fresh air shouldn't be taken for granted.
It's really, really terrifying not to be able to inhale.
A very real concern if she gets COVID, which is why she wants a 3rd vaccine to protect herself.
There's been some really good studies showing that a booster shot in these populations in particular will certainly, give them better protection.
Already, the U.S. has recommended 3rd doses for those over 65 and may soon lower that eligibility to 40 plus. Meantime, in the UK, boosters are now being offered for those 50 and older. But here, Canadians over 64 are still waiting.
The National Advisory Committee on Immunisation is going to be making further recommendations quite soon.
But public health officials aren't saying when. Only the Northwest Territories have opened up the option to all residents 60 and older.
The problem now is we have people who, have been vaccinated, but may not really know that they may not be protected as well as they thought they were.
Researcher Rod Russell says we only need to look to places like Israel to see there's a risk in waiting to give additional doses to older, more vulnerable populations.
6 to 7 months post second shot, there was, increased breakthrough infection.
And in the mortality rate in certain age groups, too. As of October 2nd, 520 fully vaccinated Canadians have died. Russell says seniors, especially those with underlying conditions who were vaccinated more than 6 months ago, should now act as if they haven't got the shot at all. Silver got her final jab in August.
You get older, your defenses run down, so any kind of assistance is appreciated.
A boost she says she's ready to take anytime. Jamie Maracher, Global News, Toronto.
An unfolding disaster in India. Coming up, the race to rescue people from raging floodwaters. Plus, why the Queen just canceled a trip and a top honor to a fierce critic of Russia's president. Queen Elizabeth was all smiles last night as she hosted some of the most influential business leaders in the world at Windsor Castle. But the Global Investment Summit will be her last official public event for the next few days. The 95-year-old is reluctantly taking her doctor's advice and resting. She has canceled a 2-day visit to Northern Ireland this week. Buckingham Palace says it's not COVID-related, but as Crystal Goomansingh explains, there are a few other details.
The Queen's London home is always a draw. Visitor excitement, however, dampens slightly with worry. Her Majesty has been instructed to rest.
She's got to be a real person sometimes and just relax.
She's just not a national treasure. She's a world treasure.
She's worldly.
A treasure with a jam-packed calendar. Palace officials say the Queen is in good spirits, but disappointed at having to cancel her trip to Northern Ireland. The 95-year-old looked well Tuesday night as she hosted business leaders at Windsor Castle. Last week, she visited the Welsh Parliament with the use of a cane, but still looked strong.
The Queen has been incredibly busy, and her schedule likely won't ease up anytime soon. 2022 is her Platinum Jubilee year, and there are all kinds of events to honor the fact that she will have served the public of the Commonwealth for 70 years.
You do think about it, but we wish her best in luck with her health.
The Queen is, quote, reluctantly accepting her doctor's advice for rest. She reportedly believes you are only as old as you feel, a line shared by her private secretary in a letter to the UK's Oldie magazine. She declined their Oldie of the Year award, saying she didn't feel she met the criteria. Crystal Goomansingh, Global News, London.
The rising death toll from COVID-19 in Russia has triggered a lockdown there. More than 1,000 people have died of the virus in the past day. That's the highest number since the pandemic began. President Vladimir Putin is ordering most Russians to stay home from work for a week later this month. That will keep some people off the crowded transit systems, but restrictions around most public venues are being left up to local authorities. Vladimir Putin's fiercest rival is being honored by the European Union. Russian opposition leader Alexei Navalny has been given the EU's top human rights award. Navalny is in prison in Russia. The 45-year-old activist was arrested in January after traveling abroad for treatment. He was poisoned with a nerve agent. The president of the European Parliament says the award recognizes Navalny's immense bravery in fighting the corruption of the Putin regime. The EU is also renewing calls for Navalny's release. Still ahead, the groundbreaking medical procedure involving a pig that could change human lives. The Indian Air Force is stepping in to rescue villagers from the rising floodwaters ravaging the Himalayan region and neighboring Nepal. More than 300 millimeters of rain fell in just 24 hours in some places. Streets are swamped with knee-deep water. The extreme weather has killed at least 150 people and many others are still missing. There's an important surgical first in organ transplants. Doctors in New York were able to attach a kidney grown in a genetically altered pig to a human and then watch as it began to function properly. The procedure is raising hopes for thousands of people waiting for a donor organ, but it's also raising concerns, as Eric Sorensen explains.
It is a breakthrough that could change lives while pushing the boundaries of cross-species transplants. The surgery was performed on a patient already brain dead, the family consenting to the experiment before she was taken off life support. The greatest medical hurdle in transplanting a pig's kidney has always been aggressive rejection by the human immune system. But from this pig came an extraordinary kidney. It was genetically modified to take out the gene that could trigger rejection. The organ was then grafted onto the veins of the leg of the patient and observed for 54 hours, doctors watching for rejection. Instead, it worked, producing primarily urine, just what a kidney is supposed to do.
So two things, no evidence of this, vigorous early rejection. And the second thing, the kidney functioned well. The significance of moving, this into a human, I think can't be understated.
In Canada, 4 million people have kidney disease, according to the Kidney Foundation. The need for organs every year greater than the number of donors. Last year, more than 4,000 Canadians were waiting for a transplant, heart, lung, liver, or kidney. 280 patients died waiting for their transplant. And of the 4,000 still waiting, 78% needed kidneys. But a medical breakthrough can also raise ethical questions. Some may object for religious reasons. Others uncomfortable harvesting organs from pigs, even though millions of pigs are already raised to feed humans.
One of the considerations really is that these highly evolved animals, they have the capacity to feel pain and to suffer. It is not resolved by saying, well, we're eating pigs every day, because that begs the question of whether we should be eating them every day.
Doctors say the next step would be transplant surgeries to extend the lives of the living, to improve quality of life for a year or longer, and reduce the number who are waiting and dying without a transplant at all. Eric Sorensen, Global News, Toronto.
Facebook's new chapter next, the company's ambitious plan to rebrand. Facebook has faced a ton of criticism for allowing hate and misinformation to spread on the platform and profiting from it. And now its CEO is reported to be on the verge of rebranding his company. Mark Zuckerberg has said the key to Facebook's future is something called the metaverse. If you don't know what that is, you are not alone. Here's Jackson Prosco.
Facebook revolutionized the way we connect. The company's next big step could be one that changes everything about online.
They see the writing on the wall. They see that they need to evolve themselves.
Tech website The Verge reports Facebook is getting ready to rebrand with a new name and new focus. The company declined to comment to Global News. The Facebook site, along with Instagram and WhatsApp, would be platforms operated by a parent company that's built around something bigger, the so-called metaverse.
What is the metaverse?
So the metaverse is really the successor to today's mobile internet. You have to think about it as the future of what comes next.
Expert Kathy Hackle describes the metaverse as the next generation online space that will blend elements of our real world with a virtual one.
So we're heading into this convergence of physical and digital lives.
Facebook already owns Oculus, which makes virtual reality goggles, and recently revealed workrooms for VR meetings. There, users interact in a digital meeting room as 3D avatars that mimic their real-life movements. Think Zoom on steroids.
I always wanted to help build this kind of immersive system that you could be in with your friends and feel like you were present together, but go explore.
The company recently announced plans to hire 10,000 workers to build the metaverse. But back in the real world, Facebook, by any name, faces serious problems.
Facebook consistently chose to prioritize its profits.
Former employee Frances Haugen recently blew the whistle on company policies she claims amplified misinformation and harmful content. Governments around the world have accused the social media giant of abusing its monopoly. A new name and new product designed to help escape reality won't make any of that disappear. Jackson Prosco, Global News, Washington.
And that is Global National for this Wednesday. I'm Donna Friesen. Tonight's Your Canada is Cape Spear, Newfoundland and Labrador, the most easterly point in North America. We'd love to see your Canada. Please email it to viewers@globalnational.com. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.